and welcome to BORNO Health Update. My name is Ibrahim Amarawa. As you are aware, Health Update is a program designed to update you on Governor Zulum's transformation drive in the healthcare sector under the stewardship of Professor Baba Malamgana, the Commissioner of Health and Human Services. Repositioning the entire healthcare system of Borno is at the top of Governor Zulum's administration list. To achieve the said goals, the Commissioner of Health and Human Services, Professor Baba Malamgana, is working round the clock to ensure the healthcare system of the state meets the test of time. Apart from construction of new hospitals at the both primary and secondary levels, the renovation and upgrade of some of the health facilities have also received the desired government attention. According to Professor Baba Malamgana, Brigadier Abakari Memorial Hospital, Garnam, in the metropolis, is one of the hospitals that witnessed a total overhaul this year to provide healthcare services needed to the surrounding communities. The Commissioner also unveiled government's plan to construct orthopedic hospitals in the state capital.
The foot soldiers marching towards actualization of what His Excellency wants to see and reposition Borno State healthcare services. In this year's budget, for example, the places for reconstruction, renovation have been many of them. New hospitals are being built across the state. For example, the Brigadier Abakari Hospital, which is located here in Maiduguri, is also completed and ready for commissioning. This hospital is now completed, and we are waiting on His Excellency to actually to commission it. This hospital has got two parts. One is mother and child wing, which is completely been upgraded to best standards, as well as the general hospital side. This has now also been completed and equipped. So we are waiting for a date and also arrangements for human resources for health. We're making those arrangements. Once this came into fruition, then His Excellency may wish to go ahead to, declare the hospital available to the public for use. And very soon we expect His Excellency to do the breaking ground ceremony for an orthopedics hospital in Maiduguri, which, as your viewers may wish to recall, the nearest orthopedic hospital is in Kano, Dala Kano, which is too far to carry somebody with broken bones to Kano. So His Excellency graciously has provided the people of Borno State in this year's budget a hospital, brand new hospital.
That was the Commissioner of Health giving an update on government plans to build orthopedic hospitals here in Maiduguri. As the Commissioner mentioned in a recent interview regarding the purchase of drugs by Borno State government, and I quote, "A hospital without drugs is just a mere consulting place," and I totally agree with that statement. One of the innovations brought to the healthcare sector by the present administrations in regards to issue of drugs is the creation of Borno Drug Medicine and Consumable Agency. The agency was created to ensure sanity in the supply and distribution of drugs in all government hospitals. Let's hear also from the Commissioner.
Your viewers may recall the hospitals will be mere consulting places without drugs being available. And therefore, His Excellency, in his magnanimity, has created an agency through the Borno State Assembly and signed it into law in September last year. This agency is the Borno State Borno State Drugs Medical Consumables Agency. The pioneer staff of the agency have been in place. It's headed by an executive secretary and a board. And recently, in July this year, I headed the team to Lagos, where I met up with 15 multinational drug manufacturers, and we signed a memorandum of understanding with them. And this gave us opportunity of getting discounts from these manufacturers, up to 50% discounts they promised to give us. And indeed, they fulfilled their promises, because we have ordered initial stock for the Drugs and Medical Supply Agency. It also means that henceforth, all the drugs coming to Borno State are from a sure source, meaning that we don't expect them to be fake in any shape or form. And therefore, it's very important for us in Borno State. And also the issue of out of stock syndrome, whereby when patients are prescribed medication, we used to have what is called OS, which stands for out of stock. This is no longer happening in Borno State. This is very crucial, and as a matter of fact, the warehouse where these drugs are being stored is being upgraded, courtesy of Northeast Development Commission, to international standards, whereby it will be upgraded to pharma grade, and therefore we can store any type of drugs in such facilities. And therefore, we also will have, or are planning to have, every senatorial zone, we're going to have a warehouse. One in the northern zone will be in Manguno, and in the southern zone, it will be based in Biu. And these places will be linked with the central one here in Maiduguri, so much so that at any point in time, I can watch the dashboards and actually see drug movements live on my handset, in my office, or wherever I am. And also, if we will bring it to the barest minimum, and filtrage that will take place in such facilities. And there will be chillers in the system, there will be CCTV in the system, so much so that this will be a place where we can safely store our drug and distribute them to the state. And furthermore, His Excellency has actually declared free maternal drugs, and this will now be coming through the BOTMA, or Borno State Drugs and Medical Supply Agency, to ensure that all the nooks and crannies of the state are, served with these medications to our pregnant mothers throughout the state.
To accomplish the huge government investment in infrastructure, as always emphasized by the Commissioner of Health and Human Services, human resource for health is also essential. The ministry brought in one of the leading online health training institutions in the world to Maiduguri, with the view to partner with the training institution of the state to enhance their performance.
Leading digital learning and teaching platform for health education, and it offers comprehensive medical and nursing curricular coverage in a digital platform. Professor Lux has over 30 years of experience, and you may wish to know that Leipzig University is one of the oldest universities in Europe. It was established in 1409 and has been running research and teaching for over 600 years. They have produced more than 10 Nobel Prize winners, if I'm right. They produced more than 10 Nobel Prize winners. So they have the vast experience, and now it's available in digital form, which I feel we should leverage on. Lecturia has been instrumental in supporting strategic planning and operational developments related to digital health education interventions. and they collaborate with medical faculties, nursing colleges, ministries of health, education, partnering with both public and private sectors. Professor Lutz has a PhD and is involved in coordinating and management of large-scale capacity building projects in collaboration with prestigious entities such as the European Union, the European Parliament, and major European, organizations. So, on that note, it's my honor and privilege to welcome Professor Lutz amongst us today. Yesterday, we spent time at the Government House at the cemetery where there were some Germans who were laid to rest. Outback in 1853 was laid to rest here in Maiduguri, and others are there as well. So the connectivity between Germany and Borno State is very long. You know, even before Maiduguri was established, 1806 Maiduguri wasn't established. So therefore, we've had lots of German researchers in the University of Maiduguri, full collaboration. Probably Professor Arab will know, Professor Kari Tijani, and others were all, they went up to Germany, spent years and came back, and the research carried on. As a matter of fact, one of the special advisor to His Excellency, Professor Abakar Hassan, who speaks German, he was in Germany. I can't remember which part of Germany he was, but he was in the hospitals where he got trained in plastic operations on how to tackle canker moris. So, it's our great honor and privilege to see you here today.
Once again, my name is Lutz Mücker. I'm the Director for Institutional Partnerships with Lake Toyo, and it's a big honor to be here. Commissioner, thank you very much again for the tour you mentioned we had yesterday. That was a wonderful insight in the history and in the current situation in Maiduguri. Maybe 3-4 more sentences about me. So I have been to Nigeria several times. The first time in 1991, and I was a very young man. And so I've followed the developments and in Nigeria a bit. I have very good friends, so to say, in the country. Yeah, that's the headline. That's what I want to introduce to you. We, Lake Toyo, we have managed over the last 16 years to establish a very advanced and comprehensive digital learning academy covering the full medical and the full nursing curricula online. We deliver an integrated precision health science education platform. We have very comprehensive learning contents there available, like I said, covering full 6 years of medical and 4, 5, or 2, whatever, however you scale nursing content for nursing education, and also big portions for community health worker education. We are digital, we are a .com organization, so we believe in data. So algorithms is one of the key words here. We have involved a lot of artificial intelligence on the academy. You will see this later. And we believe that data-driven education is very helpful. It will come clearer, afterwards. And we provide, so to say, systems under local control. So it's not a big closed box coming there from up north, from the west, brought to wherever in the world, and then you do. No, it's very flexible to localize, and we arrange academies, we tailor them, and you get full administration rights. It's all integratable from your side. So, but all that I will explain a bit later. The presentation is concentrating on 3 aspects. I would like to explain a little bit about the content is available there, what is there. Then about the teaching support, because it's not only a content source, so to say, but it's also a very powerful tool for you, the educators, the administrators, the managers, to lead digital interventions in ways previously not thinkable even. Yeah? And then also the learning support. So what is in it for the learners, the students. Let's start with the content. So I mentioned it already. We cover the full medical, the full nursing curricula. And I must underline here, of course, the theoretical part. What we have there will never ever substitute live teaching in the hospital, with the patients, with the professors, in the team. But it perfectly flanks all what you do theoretically, what you teach in the hall and as in your seminars and so on. And how do we do this? So first of all, it's like really a digital academy, mirroring, so to say, a full college or a full university online with all massive functionalities, massive contents. And here are just a few numbers. We are talking about not only tens of thousands, we talk about 100,000 plus contents in different formats. So for instance, 14,000 videos. You see here a few numbers, 12,000 high-end videos. They are, is that sharp? Can you see that? Yeah, all right. There are also, because we believe in a holistic way of education, there are also leadership courses and personal skills courses. Because, a well-educated nurse is also a project manager, for sure, because she has to manage so many things. So we have available leadership courses, personal skills courses, like project management, public speaking, team building, team management, micro and macro financing, and so on and so forth. Yeah, that's extra available to the healthcare contents. 10,000 clinical cases, 35,000 recall questions, concept pages, 10,000s of presentations, 3D anatomy models for the whole body, and so on. So very comprehensive content according to your needs. Just very fancy, very easy. Just a few button clicks. You can assemble. You can all the videos, all the concept pages, whatever you need for this course, and you click save, and then it's live, and you can forward it to your students, and so on. Comprehensive coverage of clinical skills. I mentioned that we have 10,000 clinical cases available over there. Clinical cases can be learned in tutor mode, so students can have access, they can answer them, they can work on them, but you can also use them live in classrooms or for whatever is necessary. Concept pages, this is another format. We have almost 2,000 concept pages, very comprehensive knowledge about this very topic. Here now it's the heart, the anatomy of the heart, for instance. And there are approximately, 2 to 10 pages, very condensed, embedded videos, richly illustrated. In the end of every concept page, you have the clinical relevance, plus references. And if you go to these references, they are linked, and you can click, you come to a research paper, and then you can, continue, deepen your educational experiences in reading there in depth.
That was Professor Lutz from Lectoria University. We hope this partnership will yield better results. We are going to end this program with a presentation of drugs and other items donated by Sheyi Tinubu to the Borno State government to curtail the aftermath of the devastating flood that ravaged the Borno State capital.
States. Your Excellency, Governor Zulum, the resilient people of Maiduguri, guests present, and the brave families who this devastating flood has impacted. We're here today not just as representatives of our family, but as members of a collective effort of young Nigerians to bring hope and relief to those who need it the most. This is a moment for solidarity, compassion, and immediate action. Maiduguri and Borno have rich histories and people who are incredibly resilient especially considering the challenges faced in the past few years. This is why when such a painful national tragedy occurred, it deserves our collective efforts, support, prayer, and even more our active collaboration and contribution. When our father, President Bola Ahmed Tinubu, visited Maiduguri earlier this week, he spoke about the urgent need for the private sector and individuals alike to step up in support of the communities affected. Inspired by his call, my wife and I, through the Noella Foundation, and my brother Yinka, our friends, and numerous other private sector partners have joined hands to respond swiftly to the needs of those displaced by this national tragedy. Your Excellency, we have been able to pool resources with the cooperation of many generous individuals and companies who have brought various food items, essential non-food items, survival kits, and medical supplies, and we hope that would offer immediate relief to those in need. Among the food items we are providing are over 1,000 cartons each of spaghetti, tomato paste, granite oil, salt, between 200 to 500 bags each of rice, maize, Maggi, 10,000 loaves of bread, and others. For daily necessities, we have between 1,000 to 10,000 pieces of mosquito nets, blankets, mattresses, kettles, wrappers, buckets, mats, sanitary pads, washing kits to help maintain the dignity and comfort in these most difficult times. On the medical front, we're also providing critical supplies to cover prescription for almost 50,000 children and adults, which include anti-malarial drugs, antihypertensives, antibiotics, and many others. Not stopping there, and in addition to our medical supplies, we have also mobilized 50 medical personnel within the northern eastern states to assist the already overstretched medical team in Borno State. They are here already on ground and will remain with you for the next few days to help stabilize the situation. The Borno Ministry of Health can deploy them to various camps where their services will be needed, whilst we work with our partners to deploy e-health services in a few of these places. However, this is not only just the beginning, Your Excellency. I want to assure you that our effort is not a one-time act of charity. More help is indeed on its way to help in the coming days. As we speak, we're still mobilizing additional resources beyond those that are here today to support the recovery processes until every displaced person in this most beautiful state of yours has been given an opportunity to start to rebuild their lives.
Well, viewers, we have come to the end of this week's edition of BORNO Health Update. We hope you enjoy the program. Join us next week for yet another interesting segment. Until then, I am Ibrahim Amara saying bye for now.